Prisons and jails are meant to be places of punishment, but what happens when a woman is thrown into jail while she is pregnant? What kind of care can she expect to receive, and how are systems in place to make sure that the baby is born healthy? These are questions Carolyn Sufrin learned the answers to firsthand as a medical anthropologist and an OB/GYN who worked with pregnant inmates at San Francisco Jail from 2007 to 2013.
I started working as a physician providing obstetrical and gynecologic care to women in the San Francisco Jail. And after just a few months of being a physician there, I recognized and experienced a lot of tensions and contradictions of providing care in a space of punishment. So once I began to really notice that, which I think if anyone in a caregiving profession works inside of a jail or prison, it's kind of hard to ignore that tension. It's something that I really wanted to explore more deeply.
Sufrin explores the ins and outs of being pregnant and incarcerated in her book, Jail Care, Finding the Safety Net for Women Behind Bars.
Incarcerated people are the only people in our country with a constitutional right to health care. That's something that most people aren't aware of, and that might strike some of the listeners as unusual. So if you think about it, you and I, in the so-called free world, we do not have in this country a constitutionally guaranteed right to health care. Neither does someone who was at one point incarcerated. But when they become incarcerated, they lose most of their rights. That's part of the punishment, is being stripped of most of your rights. And yet what you gain is this right to health care that you don't otherwise have outside. And that right to health care for incarcerated people comes from a 1976 Supreme Court case, Estelle versus Gamble, in which the Supreme Court said that not to provide health care or not to tend to the serious medical needs of prisoners is basically cruel and unusual punishment, therefore violates the Eighth Amendment.
Though inmates are guaranteed health care, Sufrin says there is no real standard for how attentive that health care must be across the country. She says in her years working with inmates, she saw a whole host of women as they struggled with their status as pregnant and incarcerated.
Every woman has a different response to it, but I would say what I most commonly observed among women like Evelyn and like Kima, another woman I came to know quite well, and others who were pregnant while in jail, a lot of them were really scared being pregnant behind bars, not knowing what kind of medical care they were going to receive. And in the book, I described the care that exists at the San Francisco jail. And of course, I should acknowledge that I provided some of that care. But the care that's provided at the San Francisco jail is relatively better than at many jails across this country, where women, pregnant women in particular, do not receive adequate prenatal care. And that leads some women to deliver their babies in their jail cells when they're not taken to the hospital in time. And so a lot of women in jail, a lot of pregnant women in jail are really scared about their own health and safety of being pregnant.
Sufrin says she was present once for a disturbing delivery behind bars that never left her mind since. The guards in the facility actually shackled her patient with handcuffs before the delivery.
I never even conceived that this is something that could be possible. And I was so taken aback. I didn't even know what to do. I didn't know if I had the authority to ask the prison guard to remove the shackles. I just didn't know what I would do. But I knew that it felt unsafe, and I knew that it was incredibly dehumanizing and demoralizing for the woman giving birth. And I also knew that I was unsure what I would do if there was an emergency. I actually have a colleague who told me about a time when they needed to do an emergency C-section, which required transporting a patient from her labor and delivery room into the operating room, but she was shackled to the bed, so she couldn't be transported to the operating room. And the guard was on his lunch break. And so there was no one to unlock the restraints, and this led to an unnecessary delay in emergency medical care.
Sufrin says since those incidents, much progress has been made to protect mothers from such care. Still, she says there is more that needs to be done.
Since then, there are now 22 states across this country that ban the shackling of pregnant women in labor. The Federal Bureau of Prisons also has a policy against it, and the District of Columbia also has a law. Now, that's only 22 states. That means in 28 other states, it is perfectly legal to shackle a pregnant woman in labor. It's just because our institutions of incarceration are so mired in this culture of power and hierarchy and seeing prisoners as dangerous and worthy of punishment that you have to pass a law to prohibit something that for most medical professionals and probably most people in society seems like common sense. How could a woman in labor be a risk to public safety? Could she really run off in between painful contractions? And also just the basic threats to human dignity that it poses.
Sufrin says she wants people to come away from this book understanding what types of obstacles pregnant inmates face, and then to reevaluate how those people should be treated.
These are not just women who are somewhere else who are not connected to you in any way, because these are people who are part of our society, and most of them, especially most of the women who are incarcerated, have not committed violent crimes. Most women who are in our criminal justice system are there for nonviolent offenses that are often related to their conditions of disadvantage, of poverty, of drug addiction, of racial injustice. And so these are people who are part of our society, and it's all of our responsibility to think about how we can better serve these women, better help ensure that they're not incarcerated, and make sure that they're getting better and more appropriate medical care while they're incarcerated, but also while they're in the community. So again, this is really about all of us. This is not about people who are locked up and far away from all of us. This is our society.
For more on pregnancy behind bars, including an in-depth look at postpartum depression, Carolyn Sufrin's book, Jail Care, can be found in stores and online. For more information about all of our guests, visit our site at viewpointsonline.net. You can find archives of past programs there and on iTunes and Stitcher. I'm Gary Price.
Coming up, education options for students with autism when Viewpoints returns.
There may be no car racing enthusiast quite like comedian, author, and podcaster Adam Carolla. He holds the Guinness Book of Records for the most downloaded podcasts and loves racing in one of his classic cars. Every time he takes the wheel, he seizes the opportunity to live a more exhilarating life. Now, Castrol Edge's Live on the Edge campaign shines a light on Carolla's unique character in its latest film short, Rain Starts Play.
For most people, rain stops play. For me, rain starts play. It's an opportunity, just as everything can be. It's my unceasing pursuit of fun and adventure to make my life more exhilarating. That's been the key to my success and happiness. I believe that life is exhilarating in everyday moments. Seize the opportunities. Don't run away.
Visit Castrol USA on YouTube to see Rain Starts Play, the latest Live on the Edge film featuring Adam Carolla. Take a look at how Adam seizes exhilaration in all that he does. Rain Starts Play on Castrol USA YouTube. Live on the Edge.
Individuals and businesses with tax problems, listen carefully. Do you feel like you're losing control of your finances? If you owe over $10,000 in back taxes or have unfiled tax returns, we can help you take back control. The IRS is the largest and most aggressive collection agency in the world, and they can seize your bank accounts, garnish your paycheck, close your business, and file criminal charges. Take control of your tax problem now by calling the experts at U.S. Tax Shield and take advantage of the Fresh Start program and new laws that may allow us to negotiate a settlement for the lowest amount possible. Our team of tax attorneys and enrolled agents can stop collections and get you protected so you can take control of your financial future. U.S. Tax Shield offers a price protection guaranteed quote to get you protected today. U.S. Tax Shield is A+ rated with the Better Business Bureau, so call now. 800-568-1647. That's 800-568-1647. U.S. Tax Shield. 800-568-1647.
And that's Viewpoints for this week. Viewpoints is a production of Mediatrax Communications. You can follow us on Twitter and Facebook to learn about upcoming shows and find a library of past programs on iTunes. Plus, you'll always find podcasts of our segments and information about our guests at viewpointsonline.net. Join us again next week for your public affairs magazine, Viewpoints.